Well, you see, doc, the problem is obesity runs in my family. Doctor, no, the problem is no one runs in your family. Hilarious medical memes that only guys will understand. I don't know about that, but I'm ready to laugh, so let's dive right in. I wish my wallet was thick enough to cause me some back problems. If you have a thick wallet and you're sitting on it all the time, your pelvis is gonna start tilting. Then your spine is actually gonna compensate and tilt the other direction, which then can actually cause chronic low back pain. Get the wallet out of there, maybe put it in your front pocket or debulk it. Very funny, more money, more problems. Only guys will understand 80 degrees, your balls. At 30 degrees, you're like, shrink. The scrotum definitely goes, whoop, or it gets like hot, sweaty, totally uncomfortable. When the temperature is really crazy hot, the testicles want to get further away from your body. When it's super, super cold out, get closer to your body so they can stay warm. I don't think I've ever felt that my testicles were the size of 2 large melons. The last drop is mine. Oh, that's so gross. There's typically always a little dribble that's left.
Dribble, dribble.
You have a longer urethra, and anywhere on the tract there could be a little bit of urine that doesn't totally get out when you're done urinating. No matter how many times you shake a little bit, there's always a little bit of urine. If you're shaking it too much, stop playing with it. It hits my elbow on a desk, my entire nervous system all. So here, funny bone, right? So you're actually hitting your ulnar nerve. So you're just irritating it, sending that weird feeling, and you gotta shake it out. You're not actually causing permanent damage, so it should go away. If you're continuing to have symptoms, you need to get it checked out by a neurologist. When I realized I put the wrong socks on this morning and now my feet are wet. I'm assuming you put on like dirty socks. The reason why it's an issue is because if your feet stay wet, something called trench foot, where people would get wounds, they would heal, infections would just fester. You want to prevent abrasions, blisters, opening sores, and then you also want to be able to air those out. Society and men with clear mental health issues deal with it. In general, we have a society where we have medical problems, we have mental health problems, we have surgical problems. A lot of times men will just ignore it or push it aside, but you don't have to be like running. If you're having an issue, you have to deal with the issue. That way you can move past and be the best human that you can be. I see a fountain with 2 choices. Body, organ, tissue, cell. So they're all connected. I love it. Sometimes alcoholism is something that affects multi-generations. So if somebody in your family, unfortunately, is an alcoholic, it could potentially either scare somebody that they might actually get it too from a genetic standpoint, or more apt to it due to a behavioral issue. And if you have an addictive personality, it's something you need to confront head on. Find activities or habits that are healthy that you can be addicted to, so to speak, versus anything that's detrimental or bad for your health. Getting medical advice on Facebook forums are like random poster. Oh, I'm not a doctor. We get lots of comments of people just saying, no, it's this, or no, it's that. And it's like, yeah, I can Google something too and just come up with different ideas. But if you don't know somebody's history, you can't just be like, oh, he has this, without actually examining the patient, knowing what the patient's medical history is. So bringing up concerns, bringing up your ideas of what you searched on the internet or what somebody had told you is totally fine. It's our job to then discuss with you why it would not, or why it would be, whatever your diagnosis that you come up with. Patient education on fecal impaction. Sure, this is your colon, and here is the feces growing inside your belly. Oh my gosh. A lot of times I'll show somebody on a CAT scan how much poop they have, and I'll actually say you're like FOS, full of stool. And if it's impacted, typically the doctor needs to go in and do a manual disimpaction. You double glove up, you stick your fingers in there, and you start helping pull out the poop, and it's excruciating. Please have healthy bowels, good food, walk around, drink lots of fluids, and listen to your poop signal and go to the bathroom when your body's telling you to go to the bathroom. It looks like you're pregnant. Patient, what the F? I'm a male. Doctor, I said it looks like you're pregnant. You never want to call somebody out. You never want to make anybody feel uncomfortable. But you do have the discussion as a physician. If it's just related to adipose tissue, which is too much fat, then you say, hey, what's going on? Or do you have a plan? Where you at in your diet and your habits? That sort of thing. It's always good to just have a good conversation versus telling somebody that they're overweight and whatnot. When doctors suggest husband get a vasectomy, I love it. A vasectomy is a procedure that the guy undergoes to stop the sperm from getting in your semen. That way it's not ejaculated out. They are actually even reversible. versus a tubal ligation, tying your tubes that a woman would have to do, which then is typically not reversible and then increases the risk for the woman to have other complications. They told me I could become anything I wanted, so I became a roadmap. Holy vascularity, that is a lot of blood vessels, that is a lot of veins. This guy has probably super low body fat, but is also jacked. So he's straining a lot, requiring a lot of oxygen to his tissue because of the amount of lifting that he's doing, increasing demand on the system. And he probably had some neovascularization where he's actually making new blood vessels because of the demand. That is intense. Well, you see, doc, the problem is obesity runs in my family. Doctor, no, the problem is no one runs in your family. Running is good from a cardiovascular standpoint. It's good for your heart. But majority of obesity is diet. They even say abs are made in the kitchen. Sometimes, yes, there are medical reasons why somebody might be obese. But majority of the time, it has to do with our diets, what we're eating, our lifestyle, what we're drinking. If you're suffering from obesity, having issues, please discuss it with a healthcare provider. See a nutritionist. Get some help. Find somebody on the internet. Woman, doctor, my husband wants intense sex all day. What can I give him? Doctor, my number. Totally inappropriate. We all have different levels of sex drive. Asking a doctor's advice about anything related to sexual health is important, in having that open conversation and figuring out what you could do. In this situation, it would actually probably be better to have like a sex counselor, marriage counselor. Patient acting up, they must want to take a ride in the van. The Ativan, nice. Ativan, it is a benzodiazepine. We give it to people who potentially are acting up, who are having panic attacks. Sometimes we'll actually use it for induction in procedures that you're having. It potentially can cause amnesia as well. Think about that when you're actually taking these medications. Doctor said my knee is gonna be just fine. That's a knee replacement. You can see hardware on the distal femur and then the proximal tibia. And obviously you see the genitalia just like super there. It's actually typically not that prominent. Yes, it will show up a little bit on an x-ray. Your analysis rep be like, nice watch. Oh my gosh. Okay, I can remember I was in college, I played Division I football, and we would do random drug tests. I woke up one morning, I had to test at like 8 o'clock. But immediately when you wake up, don't you just have to pee? So I went to the bathroom right away, and then I was like, oh no. I go to the testing site, literally they go in the room and they watch you. But I didn't have to urinate. So I drank like cups and cups and cups of water, and then I just, after about a half hour, finally went to the bathroom. And then I just couldn't stop going to the bathroom all day long. But it's very interesting. Sometimes people have stage fright. You have to like coach yourself, just go to the bathroom. You always get those like onlookers, or you get the people that are urinating next to you or talking to you. It's just an awkward situation. And obviously, nice watch means they're looking at your junk. Stop looking at each other's junk. We all have it. Those were interesting. Some I understood, some I kind of got, and some were hilarious. Which of these medical memes has made you laugh the most? Let me know in the comments. If you guys enjoyed that, please send me some memes that you want me to check out, react to, or you think are funny. And as always, definitely check out this playlist right here. Binge watch the whole thing. Make sure you subscribe, turn those bell notifications on, hit that like button. Thank you so much for watching, and stay healthy, my friends.